Jeff Carnes, a urologist specializing in prostate cancer at Mayo Clinic, Rochester. Here to discuss our recent findings of clinical T3 prostate cancer operated on in the modern era, defined as the PSA era, starting in 1987, and included a cohort of men from that origin to 1997. Median follow-up of these men were 14 years. We had some men with over 20-year follow-up. And this represents really long-term follow-up when anyone discusses prostate cancer therapy. The take-home message from the study is that men with a clinical T3 defined as potential prostate cancer outside of the prostate proper can enjoy a long cancer-free interval. We reported a cancer-specific survival of 80% at 20 years. Compared to a clinical T2 cohort, which is defined as organ-confined disease of approximately 90% at 20 years. We report on the concept of overstaging, and that clinical T3 sometimes is pathologic organ-confined or T2, and up to a quarter of these men. I think this also highlights our job at selecting surgical candidates for resection of these lesions. They do represent a high-risk cohort, lots of times with high-grade tumors, and the majority do exhibit pathologic T3 and sometimes undergo multimodal therapy. But ultimately, I do not believe these men should be denied a potential curative treatment such as radical prostatectomy in the setting of a clinical T3 status.